right, it gives me great pleasure to introduce our first diversity speaker from the Department of Surgery, Colonel Jeff Hutchinson from the U.S. Army. He's a proud graduate of West Point. He did his pediatrics training at UCSF, and he's currently the chair of the Department of Pediatrics, the Associate Dean of Clinical Affairs, and Chief Diversity Officer of the Uniformed Services University. He has been honored and awarded multiple times. He has a Bronze Star, various meritorious service medals, and he served with the 82nd Airborne in Operation Iraqi Freedom. I think that Colonel Hutchinson represents diversity in many forms today, other than the obvious one, by looking at him. First of all, he's a pediatrician in a room of surgeons, which we give him credit for. He's a first-generation college graduate and graduate of West Point. And I think when you look at less than 0.5% of the population is in active duty service, he represents a very unique slice of American life. So welcome, Colonel Hutchinson.
Thank you so much. Good morning. It is an absolute honor to be here. And even though I'm in uniform, what I'm about to talk about represents my opinions, not the DOD, not the U.S. Army, not USU. I have to say that part. The military is one of the most diverse and inclusive organizations in the United States. I'm still wearing the uniform because I really value being in the military. Now, of course, we have problems. We have a long way to go. There is a definite stigma towards seeking mental health. We are still fighting battles against sexual harassment and sexual assault. And there is an absolute toxic bias against obesity. When we have to take a physical fitness test every 6 months, we value fitness. And the people who don't fit our standard of what a person should look like, they are discriminated against. But there's pretty good evidence that says that the color of my uniform probably has more to do with how I'm treated than the color of my skin. That's something that I wasn't as aware of until I really started looking more into health disparities and discrimination. But people say that the military is not a place for social experiments. People say the military is a place where you learn how to perpetrate violence, to kill people, to be aggressive in certain areas. It's not a place to learn how to get along. And I disagree. Before 9/11, the military was dangerous. I was a brigade surgeon, and I have to tell you the caveat. When we use surgeon in the military, it doesn't mean I'm a surgeon like you are. It goes with a classical term of every doctor was considered a surgeon. So as a brigade surgeon, I was in charge of about 3,000 infantrymen and the people who supported them. In 2000, at Pokuhaku in Hawaii, we have a training facility. There we would do live fire, we would do training exercises, and I had PAs and physicians underneath me. Unfortunately, one night, we had a night exercise where our combat engineers, their task was to put in a Bangalore torpedo, which is this tube-shaped apparatus, underneath concertina wire. The idea was it would explode and make a breach, and the team could rush through it. That night, the det cord, the fuse that was laid, was not done properly. It did an explosion before the main explosion. The team of 5 heard that, got up to rush the barrier, and then the Bangalore torpedo exploded. We lost Specialist Don Falter because of shrapnel that entered his body. The military has always been a dangerous place. I tell you that story because those actions that night, I was actually on the field. Typically, the brigade surgeon is further back with command and control, but I just switched places with one of my battalion surgeons so that I could see what's happening and be there available. That night, specialists, medics, soldiers who had not seen combat rose to the occasion. One of our medics, who had been considered a troublemaker, someone who just didn't belong, he received an award for his heroism, for his quick thinking, for the actions he did to help the other 4 people survive after that explosion. If we judge people based on the fact that you can only do certain things, that you are only a certain way, that you have to prove yourself a certain way, we're going to miss out on all the opportunity. These last 15 years of war have proven that there are so many people that we need to be effective. The military is absolutely a social experiment. Where else do you bring people from different parts of the world, different parts of the country, different socioeconomic, different races, different genders, together to do controlled violence? That is a social experiment. And I think any field that values both discipline and skill needs the same thing, and that's surgery. It is not normal social behavior to say, go ahead and cut into me, and to believe that someone will either take out or repair something and that you'll wake up afterwards. Surgery is another social situation that requires more than one viewpoint, more than one person. As we move along and think about what areas of the world need diversity, surgery, medicine, the military, we are all part of this unit that is important. Now, I asked before, or I sent out if people would do the implicit association test. Just by show of hands, can you tell me if you've ever taken an implicit association test, the Harvard Implicit Association Test? Okay, great, that helps. So half of you have not. Let me explain what it actually is. It's a computerized test. It shows you words like happy, words like sad, angry, positive or negative words that we associate. And then it shows you either a picture of someone or another word, such as science, such as biology, such as mathematics, and tells you, associate this with liberal arts, associate this with science, associate this with male, associate this with female. It'll use words like aunt and uncle and niece and nephew, words that we associate with one or the other. Then with buttons, it'll say, as quickly as you can, put a word in a category, either left or right. So what this test looks for is how quickly we associate certain things with certain characteristics. I took the IAT, I've taken almost all of them, they're about 14. I took the one about women in science. Fortunately, I was neutral. What does that mean? It means that I don't have a bias. I don't associate women having to do liberal arts. I don't associate men having to do liberal arts. It doesn't matter to me what your gender is. I took the IAT for race, African American and European American. And the first time, I came out where I had a preference, according to this, a preference for European Americans. That surprised me. I thought, but I'm in this skin. Of course I should have a preference for African Americans. That's what I am. So then I kept thinking more, looking more, and deciding, well, what does this really mean? And if you notice one thing, it changed from association to preference. Preference is a loaded word. Preference means you prefer something over another. I prefer to go to the movies than to go to the gym, right? But I associate muscular people, thick-necked people with the gym. That's an association. Does preference or association change behavior? That's something that we still don't know. So I also understand people who say this test is more about how good you are at video games, but it's not. It talks about the ruts, the pathways that we form in our mind. If over and over and over again you think of something a certain way, it's a heuristic. It's an easy way to think about it. If you believe in muscle memory, you have to believe that there are some pathways of the way we think that are just easier than other paths. And when it comes to different races and genders, is it surprising that I associate negative words with black people? Is it surprising that it's harder for me to associate those positive words with black people? The fortunate thing is that after first taking this test a couple of years ago and the constant work I've been doing with diversity, I took it again and I came back neutral. There's not good evidence that we can change this. In fact, there's a lot of studies that say people really don't change very much. But that at least gave me hope that maybe there is a way to change it. And I think the way that I changed it is because I started questioning identity. I started asking myself, what does that really mean? If someone thinks of Puerto Rico as not part of America, if they confuse Puerto Rico with Brazil and don't even realize that it is part of the United States, can that be changed? Is that part of the reason why people are giving less? Why people talk about it less? Now put apart all the other news that comes out. When we think about certain groups, we have a certain image in mind. And that image, seen over and over and over again, plays to the way that we interact. Same thing goes with the LGBT community. Fortunately, more and more positive, more and more different and diverse images are being seen. But the average American, if this is what they're exposed to, what associations do they make? What about the Asian stereotype? Some people will argue that this is a model minority. Exactly the same thing. Whether our bias, whether our association is positive or negative, we make that association. Every day we learn and think and talk about something a certain way. That is an association. But is it a problem? Is it really something that we have to consciously change? And we had the discussion before, and I loved having dinner with the surgeons last night because we got to talk about war stories, surgical war stories. That's what we have in common. This is my first point. How does the military make a difference? Well, first, I want to go back to, does it matter how we think and what we feel? This study by Hoffman, just last year, in Virginia, it questioned civilians, medical students, and residents, and asked them different questions about what African Americans have. And one was about thickness of the skin. 25% of residents believe that African Americans have thicker skin. So that belief, might that affect how they behave? Behavior is so complex that you can't say automatically that belief does that. So it takes more studying. But I am a firm believer that what you associate with, what you believe, what you prefer, it influences how we behave. But it's going to take a lot of research to figure out how exactly that works. The fortunate thing is that we can combat it. And the best way of combating it is by having systems in place and structures in place that everyone knows and everyone expects. In the military, if you have a combat patch on, I know you went to combat. If you're wearing a stethoscope, I might assume you're a doctor, but you may not be. Having identifiable traits that tell you that you've been through something that everyone else in that position has been through gives a structure and gives a sense of, yes, we're all in the same team. Yes, I may have other thoughts and preferences and associations with you, but at least I have this positive association with what you do that I know because I've done the same thing. We talk about a meritocracy, meaning that if I do certain things, I should be able to achieve certain things. The only true meritocracy or thing that is meritorious in the United States is getting your driver's license. You do a test, you pay the money, and you pass the driver's test. Then you get a driver's license. Everything else, the moment there's a selection committee, that goes away. And why? Because it's a limited resource. We can give everybody a driver's license. We can't give everybody an MD degree. We can't let everyone be a surgeon. We have to have some discrimination to let people do certain things. That's normal. So that's not unexpected. But where meritocracy is an illusion is when we try to explain why we picked one person over another. Let me tell you the story about in the Navy and how we promote people. So you know about selecting for residency, for fellowship and all. But in the military, every single year, we're not only judged on how we are as physicians, but we're also judged on how we are as military officers. In the Navy, it's called a FITREP, a fitness report. And in that report, there are different areas that you're judged on: your leadership, how much money you saved, your fitness level, your physical fitness level. All those things are judged. And you're judged against your peers. People have the same rank. I'm an 06, a colonel. It would be a captain in the Navy. So I sat on a board looking at 10 captains in the Navy, and the problem was they had to be ranked. You couldn't just say everyone is excellent and then we're done with it. You had to say in order who was the best, who was second, who was third, and so on. Now, these are people at medical school. These are people like you. They're excellent. Why would you think anyone is better than another person? How did we decide? One of the persons was a chair. A chair has the opportunity to publish, works with a lot of people on national committees, is in charge of a large group of people. That person obviously has done extraordinary things, and they may have been in that rank for about 10 years. They're going up against someone who may have been in the rank 2 years. There's no way possible that they could have the same amount of accomplishments. So what happens? We have a ladder. We have someone on top because they've been there forever, they've done a lot of great things, and then people right down the ladder, and no one's getting off the ladder. So you're stuck there. That is the system that we force people into. The military is great in a lot of ways. There's a lot of things that we do to try and eliminate the bias that comes with selecting somebody. But forcing a rank order is one of the ways that we perpetuate the fact that if you already have it, you're going to get more. If you don't have it, you have to wait for someone to fall off the ladder. And that's very difficult. But that's exactly what I was told. I asked, what are we going to do to help this person who needs a higher rating to get promoted? And the answer was, you're just going to have to wait till the person goes. That's meritocracy. Is someone who scored a 260 on our boards going to be a better surgeon than someone who scored 230? No. We don't know that. But that's one of the things that we use to determine who should be in different programs. We need something. We have to decide. So we look at those objective things. We look at reports from people. We see someone's evaluation that says he was fantastic, and someone else who says she was moody. And what do we decide about that? Very subjective. If we can make it as standardized as possible, if we can be aware of the fact that we are judging people on not always objective things, and if we can discount what the objective things really mean, that can help us to choose better. There really should be a threshold. And the threshold for boards and someone being successful as a surgeon is probably lower than the passing rate, to be honest. But you're not going to accept anybody who just barely passed, because you have people who more than barely passed. But think about it the next time you're making a decision. When we're tired, when we're hungry, when we are faced with making that decision of who we pick, we like to pick people who are like us. If they wear the same uniform, if I meet someone who went to West Point, immediately I can think, you know what I've been through. I know what you've been through. It's easy. It's a mental shortcut to pick people like us. We think of people who've been through the same obstacles we've been through. You have that badge, I have that badge. I know what you're like. We've been beat up by different things. We both know that. We both know how to fire a weapon. I think I'll pick you because we're similar. And most importantly, in the military, everyone who's worn a uniform knows how to hurry up and wait. How to stand in formation and just wait for whatever next is going to happen. This is the one area that I think the military helps to bond people. When you've been through certain things, you know certain things. And that's something that any organization can take away. Knowing that the people around you are in the same boat, have done the same things, helps you to see them a little bit differently. Now, at dinner and through some of my discussions yesterday, people kept asking me about football and kneeling. Now, I also had a conversation about too many sports analogies. Someone told me once that that's very male-centric. If you talk about football all the time and you never play football, you're kind of left out of the conversation. So bear with me. I'm going to talk both about the kneeling and use the football analogy because I think it's important for my next point. So we all know what's been going on with the NFL. We all know that taking a knee is a form of protest against violence against African Americans by police. What's my take? I have friends on both sides. Again, being from West Point, I have very conservative friends, not as many liberal friends, but going to school in San Francisco, I have plenty of liberal friends. And being from California, plenty of liberal friends. So people on both sides. One thing I say is that if you're complaining that the flag represents people who've lost their lives, who have bled for this country, and you have never served, I would like you to be quiet. Because few of us have served and have earned that right to say what this flag represents and people who they've lost and the blood that has been shed. But the thing that really closed the argument for me was this statement. If you really believe that this is all about taking a knee and protesting the flag, this is just a smokescreen. It's just a distraction to say that one group is allowed to protest one way, non-violently, but other groups are not. So that's how I feel about that. My football analogy. Football requires different positions, different players, different abilities. If everybody was the quarterback, you'd have a horrible team. You have to have people who specialize in different things. The military does the same thing. Less than 10% of people are what we call trigger pullers, or people like snipers, people who actually kill other people directly. That's 90% of the military who support those 10% of people. We need that. Think about in the operating room. If the person working next to you is on your team, but they're thinking exactly like you, and they're afraid to tell you if you do something wrong, what's going to happen to that team? How would it be if you had to reach and grab each instrument yourself? That would be horrible, right? We need every single person to do a different job. We need that diversity to make us stronger. And that's as simple as it gets. Our identity comes in many different ways. I told you before that I can tell someone's been to combat by what they're wearing. I can tell how long they've been in combat by different things on their uniform. It shows part of our identity. And that identity helps to pull us together. Now, I never like getting together as a group without leaving something practical. You know, to me, if you forget all this, we wasted our time. Learning comes because we either change our actions or change the way that we think. So I'm going to give you 3 things that I think you might be able to use going forward if this is important to you. The first one, I get right from your vision statement. When I read this, you're dedicated to inventing the surgery of the future. That is exciting. You can tell people, I'm part of an organization that is creating the surgery of the future. Is that what people say? Is that what you think of yourselves when you're here? Or do you think, I'm just making it day to day? I'm just doing the surgery I need to do. Is the mission of your organization speaking to you? If it's not, that is the first thing that you can do. You won't attract new people with a mission like, I do surgery. You can do surgery anywhere. You'll attract people by giving them something to be excited about. We do surgery that no one else does. I want to be part of that. In the military, our mission, especially in the medical corps, is that we take care of those who are in harm's way. We know that our work is valuable to take care of the people who can't take care of themselves.
So who's good, who's bad, who's a threat, isn't, has to be made almost instantaneously. And this was a beautiful event, right? In the fact that it was complete fog of war. We don't know what's going on. Guys in a non-standard uniform. I got what appears to be a threat.
That's just a little snippet of how we train our medical students. Every year, they get together. The first years are the patients. The fourth years are the ones managing these patients. They're reminded that the work that they are doing could one day be to save someone on a field of combat. So if you ask people who wear the uniform in military medicine, what does the military medicine do? I care for those who are in harm's way. And when I'm not in the battlefield, I care for their family members and for veterans. That is the mission that brings people to the military. That type of mission can bring people to whatever organization you want. So that's getting them there. Once there, how do you keep them? Oops, I skipped one. The firing range is something that we all go through. It's long hours of laying in the sun, just waiting for the targets to go up, waiting for them to go down, walking back and forth. The analogy for surgery is holding a retractor, right? We've all done that. How do you make it meaningful? At the end of the day, the person holding the retractor, will they call home and say, guess what, Mom? I got to hold a retractor for 4 hours. Not likely. Unless you as the attending, while they're holding that retractor, are talking to them. They feel like part of the team. They understand that if you weren't holding that retractor, I couldn't see. I wouldn't be able to do what I need to do. You're valuable. Why are you here? What do you want to know about surgery? So making every experience something meaningful is the way to keep people connected to your unit, to make them feel like they are part of the team. Firing a weapon can be done. Firing a weapon knowing that everyone else in line is firing a weapon because one day they may be protecting you or you may be protecting someone else, that's very different. So find a way to make every experience meaningful, valuable, and something that they can call home or tell their spouse about. And then lastly, having metrics. We have the lowest diet of wounds rate ever. And it's because of surgeons, it's because of pediatricians in the front lines, it's because of medics not only doing their job, but sharing what they've done. They measure outcomes. They tell people. Now, there's a lot of pressure from the outside, right? For RVUs, for publishing, for lots of other things that are administrative. But do they change things? The things that really matter, we have to measure. Because if we don't measure them, people think they don't matter. So, measuring what's important, whether it's people feel included in your department, whether the people in your department represent the future of surgery, all those things you have to measure to make a change. I chose this picture because it represents 4 things about me that you can tell by looking at my CV. I'm black, I'm a male, pediatrician, and in the military. Those things you can see. What you don't know is that my dad retired from the LAPD and he joined after the Watts riots because he saw that it was an organization that had horrible discrimination. And he wanted to make a difference. Something I didn't know about him until the last few years because we just didn't talk about it. But what these 4 areas have in common for me is that service and selfless service is really important. I love everyone who has that same selfless service attitude, from first responders to teachers to doctors to counselors. All those people are very valuable to me. And for my characteristic, being able to protect, that is my overarching characteristic that I feel about myself. And because of that desire to protect, I'm in this field. Before doing this, I had the privilege of not really worrying about health disparities, about discrepancy. I got to be called sir almost every single day. I didn't think about it. But as I started looking at infant mortality, I started looking at pain management, as I started looking at all the things that are not quite fair, I couldn't stop seeing it. I see it every day. And now, knowing enough that I know about my identity and knowing that I can have more than one identity at the same time, where I go now is I am determined to be as much of a protector, as much of an advocate for those who cannot protect themselves. By you being here today, by you even thinking about, caring about diversity and inclusion, I think you think the same way. There are people that you feel responsible for. And my one request is that you widen that circle of who you feel responsible for. That is the biggest key to changing diversity and inclusion. Thank you very much.